you know that headache is different from headache. Some headache could just be roundabout as if they tie you bandage. Normal, abi. And there are some kind of headache that are just in front of your head like this, maybe due to catarrh or anything else. And there are some kind of headache you just know that this one is sent directly from the kingdom of darkness to kill and destroy. It is crazily one-sided like this, as if your brain is breathing, as if muzzle will catch your brain. You would want to cry, but you can't, because the more you cry, the more painful it is. So you no go feel cry, you no go feel laugh, you will just dey look like evening service. That kind of headache, you won't shake your head too much, because if you do, it will seem as if they carry 4x4 plank, they will wipe your head. Now listen, headache happen majorly because there is pressure in your skull. Now there's what we call blood vessel spasm. That means your arteries and your veins, they shrink. That's now create a lot of pressure in your brain. You know, there are some wires like this we call nociceptors. They release some chemicals inside your brain to make it swell, and then for the muscles in your head that are very super sensitive, they will pick it up, and then headache begins to happen. I just hope we get that. For the first type of headache I mentioned, that roundabout, it can be as a result of dehydration, stress, anxiety, catarrh, or pregnancy, anything whatsoever. And of course, it can be treated with all these anti-inflammatory drugs like paracetamol. So you say, avoid dehydration, avoid too much stress. And you see, for that one-sided crazy one that also affects your eyes like this, it can be very, very severe. It can last up to 3 to 4 days. It can cause hallucination that you'll be seeing flashlights like this. I'm sure you can relate. For that one, it is advisable that you use a towel, soak it inside a very cold water, squeeze it up, and then just lay it down there to just reduce that intracranial pressure. You get what I'm saying, right? And then those over-the-counter drugs too can help you out. And then you self avoid hyperactivity. You're just going up and down, you're doing different kind of things. And then sunlight too much of sun can cause migraine. Also, oily food too can contribute to that. And then screen time too, when you spend so much time on the screen, it causes migraine. So those are the type of headache and then the causes and treatment that are involved in it. Follow me now for more of these updates.